All right, welcome back everybody. We have the docs of Ignite Chiropractic here, and we are going to be discussing the symptom of the month, which is sciatica. We have a list of the most common questions, so we'll be going through each of those and answering those so that way you can get a better idea of what sciatica is and what you can do about it. So I'll go ahead and I'll kick it off. What is sciatica and what causes it? Well, I'll tell you what, it is very interesting. I just briefly went through and to see what some of the major medical institutions are saying of what sciatica is and what they think causes it and what to do about it. And then I'll go over that first, and then I'll go over how we see it. So one of the major ones actually talks about sciatica. So sciatica, which we agree with, is whenever there is pain along the sciatic nerve, okay? The sciatic nerve, which it starts from the lowest part of the low back right there. So we've got the spinal cord, and then we've got the spinal nerve roots that come off. Lowest part of the back, the L4, L5, a little bit between the L5 and S1 region. Nerves come off, they come out, they spread down, they go past the hips, down the buttock region, and goes all the way down to the feet. But when it goes down into the buttock regions, when it turns into the sciatic nerve, hence the name sciatica. So it's building off of that, meaning that there's pain, there's irritation, inflammation going along the nerve root of the sciatic nerve. So what is sciatica? Well, now you know what that is, but it presents itself as pain, numbness, tingling, anywhere from the low back down into the buttock region, around the hips, can go down the back of the thigh, down the calf, down to the foot. And here's the crazy thing, it doesn't have to go that full representation. It can sometimes just be in the buttock region. Sometimes it's just in the hip. Sometimes it's just in the low back. Sometimes it'll skip areas and you'll feel it go down the calf and into the foot. And then sometimes it gets to be called things like plantar fasciitis, or sometimes when it's in the buttock region, it'll also be called piriformis syndrome. So people kind of get that confused. What's really interesting is that places like Cleveland Clinic say that sciatica is caused from a pinched nerve. And in fact, you'll hear that across the board in many other major institutions as well, saying that that's like one of the main reasons what it's caused from. Sure, that's one possibility. However, it's kind of a misnomer whenever you think of it being a pinched nerve. When you think pinch, you literally think pinching your skin. It's cutting it off, literally cutting off the nerve. Well, that is only part of the case. Now, it could be coming from the fact that there is inflammation in the area from the fact that your body isn't moving correctly. So it's creating irritation around the nerve that's creating the pain and causing it not to present itself the way it's supposed to or function the way it's supposed to. Now, when it can be pinched off is whenever you have severe degeneration or breakdown that is actually physically compressing on the nerve. It's making the hole from where the nerve exits, not allowing it to have as much space anymore, and it could be compressing it, but it's not completely cutting it off the way you think it might be. So I just want to make sure that we clarify the difference with that. And then on top of that, some of the other things that they talk about is that it's caused from a herniated disc. Sure, and here's another misnomer, we're calling it a slipped disc. Your disc does not slip. It's just the fact that it gets, from over time, from degeneration, from severe arthritis, you lose spacing between your spinal bones, pressing on the disc space, which causes them to, yes, herniate. And sometimes that herniated disc will push onto the nerve, which could also irritate the sciatic nerve as well. So overgrowth of bones, which again, that's arthritis. And so these are things that don't seem to happen overnight unless there's a major accident or major fall. Otherwise, it happens over time is what it does. So sciatica, now you know, it's representation of a particular nerve that's being irritated, and it can present in different ways. It doesn't always have to be the entirety of the leg, buttock, and the hip, and the low back. Sometimes it's just different portions of that. So that kind of goes into the next question, which I'll spin it off now with Dr. Lee, if you can talk about what the next question is.
Sure. The next question is, what are the common symptoms of sciatica? And you covered a lot of that, but the most common symptoms of sciatica are pain that is shooting from your buttock down into the back of the thigh, all the way possibly into the calf or into the foot. Sometimes people will feel the pain going right into their big toe. And what is interesting about sciatica is it's not always associated with back pain. So sometimes you'll feel it coming right out of the low back, shooting down into the buttock. Sometimes you won't feel the shooting pain. Sometimes it'll be a numbness or a tingling. That's another thing that people will experience with sciatica, and it's a common symptom, is saying, you know, it's not really hurting, it's just, it feels numb, but it's kind of a numb pain, as if your hand is falling asleep or your foot is falling asleep, and you get that pins and needles type of a feeling that can be going into different parts of the leg. and it can skip. So you might actually just feel the numbness and tingling in your calf. And that is another common presentation of sciatica that's actually coming from that sciatic nerve that does come out of the low back. So while the low back may be involved, you're going to get the symptoms in other places. Sometimes people will actually feel a lot of pain and burning in their feet, which might mimic peripheral neuropathy, but it's actually coming from the sciatic nerve. So there are multiple presentations, but it's usually in pain in the butt. Sometimes it'll even go into the hip as well, and that's another common presentation. It'll come into the hip, or it'll even wrap around and go into your groin, which is usually coming from a different area where the nerve is being irritated. But if you have pain wrapping around into the groin, even down the front of the thigh, the back of the thigh, calf, and the foot, these are all presentations of sciatica. So we'll move on to Dr. Chris here.
All right.
You're waiting for your cue here.
I was waiting for it if you were done. All right, so the next question was, how can we tell if we have sciatica or just low back pain? So as we covered just a second ago, if you're having the traveling down the leg, that's going to be more presentation of sciatica. If you have low back pain, that can be anywhere in the lumbar spine. So that could be things that shoot up the spine, that could be things that shoot down the spine, but it could just be that achiness that you get in the middle of the back or the low back. Right down here, where sciatica is going to be that specific nerve. It's going to be traveling down the butt, down to the knee, all the way to the feet and the ankles, right? So to tell the difference, one, get checked by a doctor. Come have us do an evaluation. Let's see if it is truly sciatica or if there's something else going on in the low back. Let's take some specific x-rays. Let's see if there's any type of degeneration. Let's just make sure that everything is thorough and checked as we do here. But that's the other way to tell between low back pain as well, is just where is it going and how is it presenting itself. Mm-hmm. So I'll send the next one over to Dr. Sean on the next question.
All right, another common question that we get is sciatica a permanent condition or can it be cured? So sciatica is not permanent. Most cases of sciatica are going to resolve in 4 to 6 weeks. Typically, if there's some sort of appropriate intervention, we can manage that much quicker than that 4 to 6 week mark. One thing that's really important to understand, though, is depending on what the underlying condition is, we may see that sciatica keeps coming back over and over again. It's usually an indicator that something's going on. As Dr. Natalie was mentioning, you could have like disc bulges that could progress to herniated discs, and then you could be having signs of degeneration going in that spine that's continually causing compression in those nerves and through there. And so you can have episode after episode. But for the most part, they're going to resolve, but you want to make sure that you figure out what that underlying cause is, and that's going to lead us into our next question with Dr. Natalie in terms of what do you do about it?
Yeah. So the next common question is, what are the treatment options for sciatica and which one is best for me? So again, I just did a little research just so I can see what other institutions are saying or what you should do about or what the treatment options are for sciatica. And yes, I'm biased, but I also have to laugh because this is absolutely something that chiropractors should, you should almost go to a chiropractor first when it comes to symptoms with the low back or when it comes to sciatica, because otherwise you're going to be sent down the train of medications and possible unnecessary surgeries otherwise, because I can tell you right now, another major institution, the top 4 treatment options that they recommended for sciatica while you're waiting to find out what exactly is going on. The first recommendation was taking oral medications, which includes anti-inflammatories, prescription pain medications, steroids, muscle relaxants. And I'm telling you, that should not be your first option, okay? Your first option should be, let's go to a chiropractor and let's see what's going on so I can truly get this taken care of appropriately. They recommended, I'm going back again, they recommended physical therapy is a second option. Physical therapy can be helpful, but here's the reality. You can't exercise your way out of a nerve condition. Sure, you can stabilize yourself, but more importantly, you need to make sure that the nerves are functioning, communicating properly to the muscles that you're exercising, so that way you are appropriately exercising and stabilizing your body. Their third option of recommendation for sciatica was spinal injections. Let's go ahead and numb the nerve that is already not functioning appropriately so you don't feel it anymore. It'd be like numbing your hand to tell that you're getting the pain when you have your hand on top of the stove. Let me just go ahead and numb it so you don't realize you need to take your hand off the stove. I know that was a pretty clear, okay, you don't want that to happen. But what I'm saying is if you're just taking spinal injections and putting anti-inflammatories in that area that is inflamed and your body's trying to tell you something is going on, Now you're going to go on doing all the things that you were doing that led you to that condition to begin with. So clearly that's not a great option either. And then their fourth recommendation of treatment is surgery. Nowhere on there did it include chiropractic care, which blows my mind. And this is from a major medical institution. And it's one of the top 3 options that shows up whenever you just quickly look, what should I do about sciatica? Go to your chiropractor, get checked. We will take specific x-rays, we'll see what's going on, we'll do specific examinations and protocols. We will let you know if this is something we can help you with, or if this is something that you do actually need to go to a major medical institution first, and then simultaneously make sure you're getting adjusted so we can clear up the issue that caused it to begin with. So that being said, I think it's pretty clear that you should make sure you get checked by a chiropractor. And so I would say that that would be the best option for you, so that way you don't go down a whole line of confusion and then let alone unnecessary treatments that could actually cause you more harm than good.
So that basically tees up my next question here, which is, can chiropractic care help with sciatica? It's very, very clear that we see a lot of patients in our office for sciatica. In fact, at any given day, probably in any chiropractic office in the country, you can guarantee that probably about 30 to 40% of the patients that are there are coming in the office with sciatic pain, because chiropractic care is phenomenal for improving sciatica symptoms, because it's a nerve-related issue. And when those nerves are being impacted by the spine, and so if you have poor spinal stability, then what it's going to do is it's going to be putting pressure on the nerves that are coming out of the low back, with either pressure from the disc or from instability in how the muscles are maintaining the structure of the spine, and that's going to then irritate the nerves that form that sciatic nerve, causing sciatic pain. So when you look and trace back to the root cause, it is a spinal imbalance that leads to sciatica in the first place. Now, there's a time and a place for some of the other options, like you were talking about, where you can take medication, you can do spinal injections, even though those are not ideal. You don't want to do those in exclusion of taking care of the bigger problem, which is the poor spinal stability that's coming from the disconnection between how the brain and spine are communicating and stabilizing itself. But if you are going to a chiropractor and you are getting adjusted, then and you just need to get through your workday, then taking medications as prescribed are sometimes a good combination, something that you can do to be able to carry out your workday just fine. And even injections, as much as there is a major detriment in your body when you're doing corticosteroid injections, you sometimes need to do that in order to just function throughout your day. But again, if you do this in exclusion of actually fixing the problem, then it's going to come back, it's going to get worse, and usually the long-term outcomes are very, very poor. And so that's what we want you to avoid. So that's a long way of answering the question, is can chiropractic care help with sciatica? Yes, every single day. Every single day. So we'll go ahead and go to the next one here. Actually kick it over to Dr. Sean about exercises and stretches.
Yeah, so the next question is, are there any exercises or stretches I can do at home to help alleviate my sciatica symptoms? Well, first and foremost, just to piggyback on the chiropractic care, you got to have proper biomechanics and neurological function, or these exercises or stretches may not be that helpful. That being said, there is a few that I really like, especially in conjunction with getting adjusted, that really help with that sciatic pain. So first, there's 2 stretches that I really like to have our patients do. Number 1 is knee to chest exercises, where you just grab the knee and you pull it up to the chest and hold that for about 30 seconds. The second one is child's pose. It comes from a yoga maneuver. Both of these you can find online real easily. You just type them in and you can get the instructions for them. But they're going to be really good at stretching and opening up that low back and really just getting a good stretch into the hip. Many people find that really helps relieve a lot of that sciatic pain. There's 2 exercises that are really beneficial as well. Most of the time we get into this problem of sciatica because we have muscle weaknesses or imbalances that have been going on. And there's 2 exercises that really help restore some of that proper muscle tone. Pelvic tilts and glute bridges, I think, are ones that work really well for that. They're designed to help strengthen that low back, those glute muscles, and also your lower abdominal muscles, which tend to be like the biggest weaknesses that contribute to these improper biomechanics that put extra stress and pressure on the spine. Now, that being said, not all of these exercises are going to work for everyone. It really kind of depends on the severity of the condition, what are the underlying causes, and what they're going to do, whether they're going to help or not. Another thing that's really important to note, if you do try some of these stretches or exercises at home, they shouldn't increase pain and they shouldn't cause new pain. You can feel some tension in a stretch as you go through those. That's completely normal, but you don't want to feel a spike or an increase in pain or new pains coming on. So that'll take us over to Dr. Chris for the next one.
So the next one that I had was, what are some lifestyle changes I can make to help prevent sciatica from reoccurring? This is a great question because if you had it before, you definitely don't want to have it again. So one of the things that I always recommend, especially during the stabilization phase of getting chiropractic care, is let's avoid the bending and twisting. This is why the exercises Dr. Sean talks about, bringing your knees to your chest, none of it involves that twisting shear motion that it causes on the spine. So one thing whenever we're trying to stabilize in the beginning stages is going to be, make sure your pelvis faces everything that you're doing. If you're trying to bend over and twist and pick something up, you're going to reactivate what's going on and irritate that nerve, cause it to get inflamed again. So until it's stable, avoid those motions. The next thing is going to be core stabilization. So we need to make sure that this is stable and can hold the tower up so nothing is breaking down anymore. Prevent that osteoarthritis buildup where things are no longer building up bone to breaking down, and allow that nerve to function and feel its best. And then it's kind of a rabbit hole that you can go down, but watch the things that inflame you. If you have higher stresses, if you have foods that inflame you and you know you don't do well with them, stay away from them. Whenever we start increasing inflammation in our body, it can go inflame any old injury that we might have. So you can go flare up that sciatic nerve just by eating something that you didn't know that inflamed you, or something that you did know inflamed you, but you took the risk and ate it anyways. So we see that a lot.
But it was so tasty.
It was so tasty. But those are a couple of things. Avoid the twisting, watch the inflammatory, and then let's start working on core strengthening and make sure that things are stable in the long run so it doesn't come back.
I like
And
it.
then I think the next one was Dr. Nat.
Yeah, so the other common question is, how long does it usually take for sciatica to go away? That was something that Dr. Sean had actually talked about, or kind of answered in one of his questions earlier. So it totally varies. Every person is different. Every person's healing journey is absolutely different. But it can take weeks, and it could take weeks into a couple months, because it depends on what your lifestyle is. So also, what are the lifestyle factors that got you there to begin with? And what are the lifestyle factors that you're still doing while you're healing, or after you feel like you have healed, that just start to like re-cause the problem over again? So really, it's something that can, and sometimes it can come on where it just seems like it lasts a day and then it fades away. But is it absolutely gone? No, it's going to take more time. So sciatica, how long does it take to go away? I would say you just bank on it being 4 to 6 weeks, or like about a couple months. And that's with you having ongoing care. Sometimes it goes away on its own. But I will caution you whenever you think it is just gone because you don't feel the pain anymore after you've waited like a month and you didn't do anything, you just kind of rested, maybe did some exercises, some other palliative care that you did at home. I would caution you to think that it's completely gone. And in fact, I would still recommend you going to get checked so you can make sure you can actually get it corrected. Have your spinal biomechanics stabilized so you truly can be stabilized appropriately, exercise, continue on with your day-to-day activities, and then make sure it doesn't come back.
Cool. So next question is, can I still work and exercise with sciatica? This is a very, very good question, and it's relevant to almost every single person who deals with sciatica, because this is how you're functioning with your daily routine. And the question is kind of mixed. It really depends. If you're bedridden, you can't get out of bed, then the clear answer is no, you can't work. But if you're asking this question, you would already know the answer if you couldn't get out of bed. But if it's slightly aggravated and there's certain movements that you do that will fire it up and irritate it, then you have to really audit what it is that you're doing at work. If you have a manual labor job, or one that you're kind of doing a lot of moving and twisting, and this could even be, say, childcare, where you're having to pick up a kid and move the kid a lot. A lot of moms that are at home picking up their child or their toddler often, or their baby, this is something that will very much aggravate and make sciatica worse, because twisting motions are the worst thing that you can do to exacerbate sciatica, and it makes it worse because it's a twisting type of a force, and that's what we want to limit ourselves from when we're trying to heal from sciatica, because you have to look at it like it's a scab. If your body is trying to heal, which it is, and you pick the scab off, guess what? It's going to take longer to heal. So anytime that you do something or you make a movement that really exaggerates the pain, and it goes from like, oh, it was a 4 out of 10 to, oh my God, it's a 10 out of 10 because you moved wrong, that's picking the scab off. So you want to, and the things that do that are usually twisting and especially bending and twisting at the same time. That puts a lot of pressure on the disc, or a lot of stress on the disc, in a way that is very unstable with. It doesn't do a really good job stabilizing that motion, especially when you're in this state. So bending and twisting is something that needs to be off limits. If your job requires it and you're not to the point where you feel like, hey, I can still go to work, I can still tolerate this to some level, it's a very big nuisance, then one of the things that we always recommend is a back brace. And so these are, you don't have to get some super fancy brace. We always actually send people over to the nearby Walmart across the street from our office to pick up a brace. The brands like Mueller are a common brace, and you'd want the ones that basically they're called lumbar supports or lumbar low back braces, and then you will wear it halfway down your butt, so a little lower than most people think, and you cinch that sucker up really, really tight. And what that does is that allows extra stability to take the pressure off of your muscles from having to do the work and spasming, and it also gives you feedback throughout the day to realize, oh yeah, I'm starting to twist, because it's not very easy to twist when you have a back brace on, and it resists that motion, and it gives you a little bit of extra added support. So that is something that is really important to recognize. And then exercise is something that you have to be really, really careful of. I would recommend that if you have even moderate sciatica symptoms, that you hold off. You really just don't. You rest it. Sometimes people hate that because they're trying to lose weight, or they have a competition coming up, and everyone has to figure this out for themselves. But to give kind of broad advice is, if it's really significant and the exercise that you're doing is making it worse, either during the exercise or after. Sometimes people say, hey, it was fine during the exercise. It wasn't bothering me. I was working out. I was doing, I was kind of modifying what I was doing, being careful. But after, when I got home, it really got sore and aggravated. Well, you did too much, and what you were doing is aggravating it. So rest is going to be one of the best things that you can do, and avoiding exercises, especially avoiding a lot of like axial loading, meaning like squats. Don't do squats. Don't do overhead presses, things where you have to do a lot of stabilization. You really want to avoid that. And even with certain things like yoga, you have to be very careful that you're not doing the twisting motions of yoga, although there are certain motions in yoga and movements that are very beneficial, as Dr. Sean was saying, that can help with the stretching, but you really want to be careful and not overdo it, and really listen to your body in the moment, and then later in the day and see, was that something that made it worse or not? And this is the feedback that your body is giving you to let you know that you actually maybe overdid it and you're not actually healing the way that you could be. So now we'll kick back to Dr. Sean.
So the next question is, what are the potential complications of sciatica? Overall, one of the biggest complications is nerve damage, especially nerve damage that can become permanent or irreversible. So there's some things that can lead up to that and some indicators to watch out for. Number one is, if you're having pain that's continuing to increase and get worse and worse and worse, that could be an indicator that something's going on that needs to really get addressed sooner rather than later, so that it doesn't continue to become something that's a long-term problem for you. One of the things that can cause that is a herniated disc. When you get a herniated disc, there's material in that disc that actually can go into the spinal canal, and when that happens, there's an immune system in your spinal canal, and it thinks that those are actually foreign materials, so it does what the immune system is supposed to do. It creates a lot of inflammation there to kind of attack it and break it up. Well, that inflammation is one of the things that can really just fire things up and make a lot of that pain increase and make it feel worse. And that takes time for that to actually break down, and eventually that'll kind of heal over and you'll get some function and stability back in there. But that's one of the other things that can be a complication with sciatica. Other things that can happen is there's different things that the nerves do. Some nerves carry fibers that are related to pain. There's other nerves that are sensory, like, you know, what do you feel going through that leg? And some people lose feeling or sensory, and so they may have balance issues, or they may be like, you know, bumping or running into things that could be potentially causing more damage to their foot or their leg, or making them susceptible to a fall. And there's other ones that are related to the strength of the muscles. So if those fibers are being affected by it, you may get weaknesses in those muscles that could also contribute to falls or creating more damage and further breakdown in spinal biomechanics and pelvic biomechanics as well. And then finally, one of the most important ones, and this one usually requires immediate attention, you know, you might want to go get a medical follow-up right away, but if you're having loss of bowel or bladder function, that's a very, very serious symptom. Do not wait for that. Please go see a doctor right away and get that checked out so that you can see what's going on with that. And that's going to lead us into our next question with Dr. Chris.
And the next question, I love this question. Can stress or anxiety make sciatica worse? Yes. So as we talked about earlier, whenever we start getting stressed or inflamed, you actually have a hormone called cortisol. That is your stress hormone. The more stressed and anxious you are, the more you release. And we talked about inflammation. That hormone creates inflammation itself if it's in the system for too long. It's not that it's a bad hormone. You need that hormone to actually respond to stress, but in excess or chronic situations, that's whenever it starts creating problems. So whenever we see people that are high anxious, high anxiety, or stress under all the time, and they never get rid of it, they release that cortisol and it inflames that old injury or that sciatic nerve area. So yes, you have to pay attention to your emotions. So if you have something on the back burner and you're just letting it burn, take care of it, get it out, talk to somebody, get that emotion out. But also get adjusted, take time for you. That's why we really set the tone in here for people to calm down, take a load off for a minute, take time for you, because it is very important to calm down and relax. The more you can do that, the more you'll feel that cortisol level decreases and the better you feel. So I love that question because there's also another factor to it. You can see it on posters in our wall everywhere in here. We talk about physical, chemical, and emotional traumas. If you have a chemical problem like cortisol being released because you have an emotional issue because you're in pain, every one of those is correlated with each other. So sciatic nerve is firing up. You're releasing cortisol. Your cortisol starts releasing more, so you start getting emotional from the pain. It's a vicious cycle that will keep going and going unless you break that pattern and do something about it. So I really love that question because that is something people really need to take care of. And then I think Dr. Nat is going to close us out.
Yeah, so this is like the 13th most common question. What can I do to prevent sciatica from getting worse? I think there are many other ways that we've answered this, and it overall comes to being aware of your body. So what can you do to prevent sciatica from getting worse? Well, first, be aware of the fact that it's something that can be taken care of, that shouldn't just be taking medications just to ignore it. Preferably you're going to a chiropractor so the chiropractor can be seeing you alongside, helping you along your journey of actually healing, and then following up in any other way based on the severity or the level of which it's going on. Making sure you're changing lifestyle factors as far as what you're doing, what's your stress levels like in your workplace, in your home place, wherever it is. As we know, thoughts, toxins, and traumas, meaning mental, chemical, and physical stressors, all play a role in relation to pain. Also take into account the types of exercises that you're doing, even though it's relieving for you. It might be chemically releasing endorphins and the feel-good hormones, but are you moving your body appropriately to be able to maintain the proper spinal biomechanics while you're enjoying those activities, whether it's running or it's yoga, or it's whatever the activity might be, walking, jogging, right? So when it comes to preventing it, making sure it's not getting worse, it's just being aware of your body, truly listening to your body when your body's trying to tell you to respond to it, and for you to take the appropriate measures, natural measures preferably, to make sure it doesn't get worse, and more importantly, for you to actually help it heal and for it to not return to begin with. So closing out, those are the most common questions when it comes to sciatica. Make sure you can utilize that so you can come back, know we have answers here. There's resources for you. You're not alone. Many people suffer from this without even knowing it, without even taking proper treatments or taking appropriate actions for it. So maybe you can not only help yourself, but help your family, loved ones, and whomever else by sharing this information with them as well.